Hello everyone, how's it going? Falls are the leading cause of injury for adults 65 and older. In fact, 1 in 4 older adults in the United States report falling each year. Well, what can be done to reduce this risk of falling? If that sounds interesting to you, then keep watching. As we get older, we are more likely to have health conditions, be taking medications, and experience loss of muscle mass. That can increase our likelihood of falling. Well, what can be done to minimize that risk? Well, let's discuss 7 things that we can do that can help prevent falls. After we discuss the 7th thing, we're going to talk about a 10-second balance test that you can take. Now, number 1 is to make an appointment with your healthcare provider. You want to let them know about any falls you've had or even almost falls. Try to make sure you can give them the details of when, where, and how it happened. They may just need to make an adjustment to one of your medications. That's why it's good to bring all the medications with you, the prescription ones, over-the-counter ones, all the supplements. That way you have a chance to discuss them with your doctor. You can find out about the side effects, the interactions. There are some medications that can affect our thinking, like sedatives, antihistamines, antidepressants. Some medications can cause low blood pressure, which could cause dizziness. That could result in a fall. Your doctor can actually help you determine if you need a calcium or vitamin D, maybe both for your bone health. They can make sure that you get screened for osteoporosis and make sure you get the appropriate treatment for that. Having the doctor evaluate your muscle strength and balance can really be helpful. Sometimes balance and walking problems are actually a combination of factors. It could be vision, it could be vestibular disorders. That's when the signals between the inner ear and the brain, they're not getting through correctly. Sometimes it causes people to have vertigo, which could also lead to a fall. There are medical conditions that can cause a person to have altered sensation in their feet, and that could also result in a fall. Number 2 is to keep up with your vision. You want to make sure that you get your eyes checked at least once a year. I read an article from the CDC that said if you have bifocal or progressive prescription glasses, that you might consider getting a pair of glasses with a distance-only prescription for when you're walking outdoors. That might possibly help you avoid some falls. Number 3 is to keep active. Some older adults, whether they've fallen or not, are very afraid of falling, and so they tend to avoid walking, shopping, getting involved with social activities. And depending on a person's health, you may have to limit certain activities, but it's so important to find something you can do to stay active because it really helps keep the body healthy. Very gentle exercise can actually improve strength, balance, coordination, and flexibility. Some that are recommended are walking and water workouts. Now, if you really have some concerns, you can have your doctor set it up so that you can work with a physical therapist to see what activities may be safe for you. But you want to find something you can do that's very consistent to keep up your body strength and your health. Number 4 is actually to wear sensible shoes. When someone wears high heels, floppy slippers, shoes with slick soles, that's really an accident waiting to happen. Even wearing socks without shoes on a slick floor can be pretty hazardous. So you want to wear shoes that fit properly, that are low-heeled, and that have non-skid soles. Wearing supportive shoes like that actually can even help reduce joint pain, besides trying to help keep you from falling. All right, so next we're going to talk about some adjustments that we can make to our home and some other helpful tips to prevent falls. But before we move on, I'd like to remind you to like and subscribe if you're enjoying today's information. Also would like to remind you to check out the links below. There you can find where I've gathered the information for this video. You'll also see some product suggestions. And feel free to leave a comment below as well if you have something that you'd like to share on this topic. Okay, so number 5 is to remove home hazards. So you want to make sure walkways do not have boxes, newspapers, or cords that could be a trip hazard. In the high traffic areas of your home, you want to make sure there are not coffee tables, magazine racks, or plant stands in the way. Another thing you can do is make sure you secure or remove any loose rugs. Sometimes you can use a double-faced tape, or just make sure you purchase rugs or mats that have that slip-resistant backing. Another thing that's very important to avoid falls is to immediately clean up spills of food or liquid. Another thing that could be helpful is to use non-slip mats in the tub and shower. That's where actually, unfortunately, a lot of falls do occur. And then you want to make sure you keep your clothing, dishes, food, and other items that you use often in easy to reach places. Now, number 6 is you want to make sure that your living space is well lit. It's really quite amazing how much brighter your house could look when you use the brighter light bulbs. My son actually put in a bright LED light in our bedroom closet. I was really amazed at how well we could see our clothing. Another thing that could be helpful is to have night lights in the bedroom, bathroom, hallways. Of course, having a lamp by the bed would be very helpful. They even have switches if they're hard to see at night. You can get the kind that are illuminated, or even the switch plate covers that are glow in the dark. Sometimes that might help. Let's see. Also, you want to make sure the room is clear. The path is clear to rooms where the switch is not right there at the entryway. I know that's the way my dad's bedroom is. He has to walk all the way to the back of the room to get to the light switch. I don't know how that came about, but that's how it's set up. You also want to make sure that you have flashlights handy for when you have a power outage. I know in our family a lot of times we needed a flashlight and they weren't working, the batteries were dead. It was kind of crazy, but they actually have some flashlights that are rechargeable. I saw recently you can just plug them right into the regular outlet and make sure they're charged up, especially around storm season when you might more likely have power outages. Very handy. You can also use the flashlight on your phone if you have a cell phone. If you don't know how to use it, just ask a family or friend, because that can really come in handy to help light your pathway in many different instances. Now, number 7 is you want to use assistive devices. So if you can have handrails on stairways, if possible on both sides. You also want to try to keep your hands free when you're going up and down stairs, because if you're carrying too much, it could block your view of where you're walking. And also, if you don't have at least one hand free, you can't hold on to the handrail, so you want to try to be careful about that with going up and down stairs. Now, some people have benefited by using a raised toilet seat. They even have the type that have armrests, give you a little more support. You can purchase grab bars for the shower or bath, and then even a shower or tub seat can make showering a lot safer. And you also want to make sure you have a handheld shower nozzle. Now, if a doctor or your physical therapist is telling you that you should be using a cane, a walker, or a wheelchair, you definitely want to make sure you're using those to try to avoid dealing with a fall and having a serious injury. Okay, so now are you ready for that 10-second balance test? Okay, now I don't want you to do this if you don't have a chair, a table, or a counter in front of you, or something that you grab onto in case you lose your balance. If you really struggle with your balance, don't even try this until you have somebody with you. I was actually surprised at the difficulty of this test because I'm used to doing balance workouts, exercises, where I can put my arms out to the sides to kind of like balance myself. Well, this one you have to have your arms to your side. So you're going to stand with both of your feet side by side with your arms to your side, and you're going to lift one foot 12 inches off the ground, and then you're going to, without lowering your raised foot, without using any support or raising your arms, you're going to try to remain on that one leg for 10 seconds. Okay, are you ready? Here we go. Okay, so how did you do? You know, doing this test can really help us to see if we need to improve our balance, which could really seriously help us to prevent a fall. Sometimes we can do something as simple as just following a DVD, an exercise DVD, to improve our strength and our balance. I'll leave some links below of some that you can try out. Now, some other helpful tips would be to avoid or limit alcohol, to rise slowly after you've been sitting or laying down to avoid dizziness. You want to try to get adequate sleep, and that's easier said than done for sure, but we do need to get some quality sleep. When someone's lacking sleep, that could cause a fall. You also want to try to stay inside when the weather's bad. That's not a good time to be going out and running errands. And really, just following some of these helpful tips can really help avoid a fall. There's so many falls that are preventable. It may just take a little bit of investment in time, perhaps even some money, but it's worth it just so that we can keep our independence for as long as possible. Falls can lead to injury, disability, and even death We definitely want to avoid any of those. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.